Hi, good morning. Thank you for having me. I'm happy today to come back and present on the TTT update course and share our evaluation findings with you today. So the presentation is going to review the TT update course components and review the evaluation of the TTT update course that me and some of my colleagues previously presented as a poster at the Bethune Roundtable in 2012. So the course itself was designed as a one-day refresher course. We held the very first one in Georgetown in Guyana in November 2010. This was the pilot course. We had 17 participants. And then we ran it again in 2011 where we actually evaluated the course that generated the data from our evaluation that I'm going to present to you today. The one-day course is similar to the TTT in that it's an interdisciplinary course, and participants that were included were orthopedic technicians, nurses, general medical officers, etc. The course content, again like the TTT, covered the skill stations, the trauma team simulations, and multiple choice quizzes. For the evaluation of the TTT update course, we used a mixed methods design using both qualitative interviews and observations combined with quantitative statistical analysis. The study had three main areas of evaluation: the participant perception and knowledge acquisition, which included pre and post interviews and multiple choice quizzes. We also looked at it from an APED learning style, or the assist, perform, evaluate, and discuss. And we wanted to look at a teamwork assessment using the traditional trauma team assessment tool and introducing a new tool called the team tool. For participant perception and knowledge acquisition, local participants were selected for pre and post-course descriptive qualitative interviews, as well as an informal group exit interview. Interviews were coded and recorded, and data was analyzed using descriptive analysis. For knowledge acquisition, the 22 participants completed a pre and post multiple choice quiz to assess the impact on immediate knowledge translation. We used a paired student t-test in order to interpret our data. The assist, perform, evaluate, and discuss format was used as it allows participants to rotate through the various roles in an attempt to teach chest tube insertion and intubation from various perspectives. What we did was we had the TTT course participants divided into 4 groups and rotated through 2 skill stations: the chest tube insertion and intubation. Both skills were taught in a non-structured and structured, which is the APED format. And all participants experienced 1 skill in a non-structured format and 1 skill in the new APED format. Local participants were then questioned during their post-course descriptive qualitative interviews regarding which learning format they preferred. For the teamwork assessment, we had 4 mock trauma resuscitations that were filmed. After the course was completed, we had the scenarios reviewed and assessed by 2 different panels: an expert panel, which included ATLS training and 2 years of trauma exposure in order to be included as an expert, and we had 12 of those. And then we had a non-expert panel of people who did not necessarily have trauma training, and we had 10 of those. The assessments were conducted using both the trauma team assessment tool and the new team tool to look at teamwork in the scenarios. The new team tool is the Teamwork Emergency Assessment Measure, and it's an assessment tool that was developed by Cooper et al. In 2010, and it comprehensively measures team performance during resuscitation scenarios. And we were interested in the inter-rater reliability, and we used the intra-class correlation coefficient calculation to do so. For the results on knowledge acquisition, all professions and non-physicians or non-general medical officers showed significant improvement from pre to post-test scores. This is expected. It's expected that the physicians would probably have similar knowledge pre and post one-day refresher. For the structured learning APED format, we found from our qualitative descriptive analysis 3 main themes: confidence, collaboration, and reinforcement. As one general medical officer stated, it's more accepted because you are allowed to interchange. You realize that your role changes 5 times on that paper and it reinforces the learning. Another participant, who's also a general medical officer, said that after using a structured APED learning format, they were more confident. The more experience you get doing these things, the more confident you feel, and the refresher really enhances your skills. I really think it might be a very good idea to have it yearly because it keeps you on your toes. For the teamwork assessment, what we found was that the team tool is considered a reliable measure by trauma team performance when used by expert evaluators only. So again, that's someone who is ATLS certified and has 2 years or more of trauma exposure. We found that the team tool was more reliable than this traditional TTA tool, but only when used by experts. The inter-rater reliability, again, was assessed using an ICC. In conclusion, from the perspective of the learner, there's a significant need for a TTT update course that allows the TTT graduates to refresh their skills at regular intervals. The majority of participants also prefer teaching methods that reinforce key concepts through interchanging their perspective and reinforcing their practice. Ultimately, the development of an official update course and manual is highly recommended and should ensure an optimal learning environment. And the suggestion from this research was to draw on the structured APED methodology and potentially change from the TTA tool to the team tool.